Hi there, this is Dr. Martha Gulati. I'm the Chief of Cardiology at the University of Arizona, and I'm the Physician Executive Director for Banner University Medical Center in Phoenix. We're at the earliest stages of planning our reopening and plan to do it in a phased-in approach starting next week. We will be in compliance with CMS recommendations in terms of our reopening. We will not be opening our hospital to visitors, so only patients that are coming in for procedures will be allowed in, and there will be separate entries for these patients compared to patients coming in either due to COVID-19 or through the emergency room. Specifically, the type of patients that we are going to start with are the low-risk, low-utilization patients, patients expected to have short lengths of stay or same-day procedures, the non-complex patients. And this is not just for cardiac patients, but for all the patients that we are going to be doing elective procedures on. We already have divided our floors from COVID floors to non-COVID floors, and so they will be kept separate if they do get admitted to the hospital. For anyone coming in for elective procedures, they will require to have an advanced testing to know if they've been exposed to COVID-19 or not. And additionally, we'll have to take into consideration concerns for where they'll be going after the procedure. We know that if they're going to assisted living or if they need short-term care or rehabilitation, they're going to need testing before they can leave our hospital as well. We do have our floors separated to protect our patients. So there's the COVID-19 floors and the non-COVID-19 floors, and hopefully this will help protect our patient population that are coming in for elective procedure. Additionally, we have separate staffing. So the staff that is both involved in the elective procedures as well as the non-COVID-19 floors, we're trying to keep them separate to minimize the risk to everyone. I think my advice to our ACC membership is that this is a process that's going to take a while to get us back to normal. There's a lot of considerations to be taken, and certainly I'm not creating these decisions. They're coming from our corporate office. You know, there's issues. We've already had staff that have been furloughed, and bringing them back in as we open up, we hope that they're available to help us. We also have to take into consideration finances now that many of our patients may have lost their health insurance if they've lost their jobs. And so we have in our system a way that we're going to address this. We have, if they're eligible for free care, that will be one possibility. We do have patient payment options where they can pay over 2 years or less. We also have evolving credit lines through third parties, and then of course the traditional ways. Again, staff that we have let off, those who are on furloughs may be able to bring them back. There are some people that had been let go, and has a potential to put strain on our system. So again, everything is going to be phased in. Our outpatient operations have not normalized, and hopefully those will, but even that is a bit of a challenge in terms of staff that we've lost and staff that we can bring back in.